Well, hello, Joel Dunning here at CTSNet, and it's my absolute honor and privilege to introduce one of the absolute giants of cardiac surgery in the world, Professor Todd Rosengart. Of course, after you worked in the wonderful United Kingdom with incredible stars such as Jaroslav Stark and Donald Ross, you are now the Professor of Cardiovascular Surgery in Michael DeBakey's unit in the Baylor College of Medicine in the incredibly world-renowned Texas Heart Institute. And the reason we've got you here today is because you have led with your team an incredible first. It's absolutely amazing, and we just wanted to talk to you about how you have brought robotics into the world of heart transplantation. So maybe, first of all, thank you very much for joining, and maybe tell us a little bit about how this came about.
Yeah, Joel, thank you. Glad to be here. And first and foremost, again, I want to make perfectly clear, I'm honored to share the work of my team, and that includes Dr. Ken Liao, who's the Chief of Cardiac Transplant in our DeBakey Department of Surgery, which I chair. In that entire unit includes Alexa Shaffey, who did the first total artificial heart with the new Bivacor device in this past year. Gabe Lohr, who has been really a leader in ex vivo lung perfusion and has one of the largest robotic and lung transplant programs, and then many others. But Ken Liao, we were fortunate to recruit probably half a dozen years now from University of Minnesota. And at the time, Ken had been very passionate about getting involved in robotic heart surgery. He really viewed this as the future. And to his credit, over the last 4 or 5 years, Ken has gone from close to zero to one of the busiest robotic heart surgeons in the country. He is approaching 1,000 robotic heart procedures now. And this has really become a mainstay of his practice. He does everything from robotic coronary bypass to multi-valve operations, and even recently has done a septal myectomy robotically. So Ken is a phenomenal surgeon and a true pioneer. And probably over the last year, he's clearly envisioned that the opportunity existed for robotic heart transplant. He is so facile with the techniques, not just the anastomosis, but the entire approach, that in his mind, he felt this was absolutely an obvious approach to make this minimally invasive. He obviously practice his technique, which I'm sure he'll share with you, in animal studies and the like, and then found a suitable patient, which ended up being the first patient transplanted with robotic heart technique in the United States, and actually the first adult in the world. The prior case, as you know, was done in Saudi Arabia at King Faisal Hospital, but that was a young adult, less than the age of 18, I believe. So I think we can take claim to first adult in the world. And I know Ken plans on moving on and doing additional cases. The patient did extraordinarily well, was a quite ill gentleman, obviously. And we recently saw him for his 100-day follow-up. And I was fortunate to be watching his progress, and it's really been dramatic.
I mean, absolutely incredible. And as the leader and chair of the unit, how do you guide a phenomenal surgeon like that through the red tape, the practice, setting up a research protocol? I mean, you slipped straight through that, but it must have been a tremendous amount of work to get to that stage safely.
Yeah, well, I would say the shorthand of that is first being a cheerleader, and second being a referee. And again, one of the challenges that any organization faces is celebrating and sponsoring and advancing their great team players, and certainly our cardiothoracic transplant represents that group. Again, Dr. Shaffey, Lohr, and Liao really bring remarkable strengths. So, we have tremendous institutional buy-in. We are pushing the envelope, as we talked about, in many different efforts. We actually have some, Dr. Lohr, I just heard today, has some amazing work going on in next generation ex vivo perfusion and preservation of organs that's going on in the laboratory. So my job is to clear the way, make sure, as you said, we deal with bureaucratic challenges, encourage and incentivize them, and give them the resources they need. But I always say that what makes success in our organization, hopefully likewise elsewhere, is this, creating the aspiration and the motivation to be the best version of yourself, achieve highest impact possible with your talents. And I think Ken's accomplishment, his imagination, his innovation, and his skill is a great example of doing something that probably just a few years ago no one would really think would be possible.
And of course, there'll be lots of people out there going, well, we're in a transplant unit, how do we take the next leap into robotics? I guess probably, obviously, Dr. Lau is very good in other operations. What would your advice be? Would you say, do 10 cadavers, or, how would someone else set up a robotic transplant unit like yourself?
Yeah, Joe, that's a great question. It's interesting when we spoke to Ken before and after. What he said, which is telling, is he had become so facile with robotic heart surgery that almost did not think of this as a breakthrough because it was just a progression from doing a robotic mitral valve, a robotic cabbage, and it had almost become indistinguishable in his own mind in terms of why would I not do a transplant robotically? I can do everything else in terms of surgical approaches to the heart with this technique, and of course, in his hands, he finds it better. So I don't know whether the threshold is 500 robotic hearts or 600 or 800. But certainly, that sort of massive number, which comes with practice initially and then repetition, learning where improvements can be found to the point where, again, as in his own mind, the difference between open laparoscopic robotic is almost indistinguishable. And again, I think Ken would argue in many cases what he did was easier robotically for a lot of different reasons. Those practicing the art will know between the magnification and the flexibility of the access, it does offer significant advantages. But what struck me was not that Ken related that it was so difficult. In fact, he related that it was so easy. Not all of us would say that was so easy, but was the way he viewed it.
And I guess as the referee, he's demonstrated that you can do it. I guess you get to be the referee of should you do it. So do you think there are real tangible benefits for the patients going minimally invasive?
Yeah, well, that's a great question, and with everything that we do as surgeons, the question should always be, even if we can do it, should we be doing it? And I do think so. This was done, just to be clear, through a subxiphoid incision, elevation of the rib cage, found an appropriately sized heart to do that approach, and the minimization of morbidity, both in Ken's mind and from what we observed, did truly pay benefits in terms of less morbidity, less complication risk, et cetera. So I do think that makes sense. And again, I think in Ken's hands, with the proficiency that he has demonstrated across the board, and he's reported on this at STS and ATS and the like, the outcomes are not only as good, but in many cases better in terms of length of stay, transfusions, other complications, and even longevity in terms of graft patency and the like. So this is not just a trade-off, although except perhaps in cost of the robot, which is made up for in longer-term costs, but actually a benefit.
Yeah, so actually, it'd be a great thing for you to maybe go through a few of the technical points. So obviously, that's a really interesting approach. Hopefully, you guys will send us a video to publish on CTSNet as well. But tell us a little bit about it. Presumably, it's fem-fem bypass, a subxiphoid incision with elevation, and then is the robot docked directly from below. And yeah, tell us a little bit about cannulation, the view, how you set up the robot. Any arms through the chest separately, or all one incision? How
Yeah,
did you
well,
do
I'm
it?
going to really defer to Ken on that. I know you will be speaking with him, but my understanding, it was not a significant deviation from his standard approaches. Obviously, with the transplant, some changes, but this was very standard approach for him.
It sounds like an absolutely amazing unit that you're leading there. I mean, we're also going to talk to one of your other surgeons about another world first, about the Bivacor total artificial heart. Maybe just in passing, why don't you tell us about your other world firsts?
Yeah, no, absolutely. So that took place last summer. We were again fortunate at Baylor College of Medicine and Texas Heart to perform first in the world, a new generation, the Bivacor device. The advantage of this is really the brainchild of Bud Frazier, a careers long work towards enhancing artificial circulation. And the concept was really frictionless, bearingless approach. This is a maglev technology where there are no bearings, there's no points of contact. And importantly, the way the computer programming of the pumping action occurs, it actually provides pulsatile flow by varying the flow rates and the pumping rates. This has now been performed through a phase 1 trial. Bivacor is the company out of Australia who has developed this. The patients all did extraordinarily well. This was bridged to transplant, as you would expect in a phase 1 trial. The longest bridge was about 100 days. I believe it was a patient from Australia. And what was interesting is on the explants, there was absolutely no thrombus formation, no wear at all on the internal coverings and the like. So very, very exciting. I know the company is planning on moving forward to hopefully imminently with phase 2 studies. But really, doctors Billy Cohn, Bud Frazier, Alexa Shappy, who is the implanting surgeon, again, breaking thresholds, and hopefully this will ultimately be a destination therapy approach to total artificial heart technology.
Wow, well, what an incredible institution you lead. It's absolutely phenomenal. We're definitely going to get into more depth with both your surgeons for the Bivacor total artificial heart and the world's first adult heart transplant surgeon. And yeah, from us here in CTSNet, what an incredible place. Thank you so much for joining us. It's a wonderful institution, and we hope to be able to show the world some of your amazing videos in the coming months.
Thanks so much, Joe. I appreciate being with you.